we mean by this term? This term refers to the passage of an infectious agent from an infected mother to her fetus, either while she is pregnant, that is to say through the placenta, or during giving birth to her child while the fetus passes through the birth canal, from contamination, of course, with cervical or vaginal secretions, or postnatally, that is to say via breastfeeding. In general, what are the possible sequelae of acute infections? That is to say, what are the possible consequences of acute infections during pregnancy? This is in general. Here we can categorize the sequelae into one of the following categories. Either if the infection may pass off without causing injury and allow term delivery of a normal child, or it may lead to fetal loss before 24 weeks gestation, that is to say spontaneous miscarriage, or it may lead to premature birth, that is to say delivery before 37 weeks gestation. Or it may cause the fetus or the child, the infant, to be born with the congenital form of the disease. وها راح نشرحها إن شاء الله in the next few slides. You know, there are certain congenital forms of that are characteristic of each viral infection. Or it may lead to intrauterine fetal death. So any woman presented with unexplained intrauterine fetal death should be screened for a possible infection with torch pathogens. Or it may cause anomalies of fetal development, resulting in either minor or major congenital deformities. Now I will come across some of the most important and famous viral infections that are well known to most of you. Starting from varicella zoster virus. طبعا varicella هي قسم يقولون varicella، المهم هي varicella بالإنجليزي. Varicella zoster virus, it is the infectious agent of what is known as chickenpox or varicella. chickenpox هذا بالعربي أو المتعارف عليه هو جدري الماء. What is this virus? It is a double-stranded DNA herpes virus, and it is acquired predominantly during childhood. يعني أنا لو أسوي survey إلى تقريبا 100% of adults population, we will find serological evidence of immunity, that is to say antibody to the virus, specific antibody to the virus, because it is a highly contagious disease. Primary infection causes varicella or chickenpox. Transmission is either via respiratory droplets or by direct contact with vesicular fluid. Therefore, the period of infectivity will last or will continue until all the vesicles becomes crossed over. يعني احنا نقول عليها تيبس، القفح الجلدي أو الحويصلات تيبس. But the infection started from 1 to 2 days prior to the onset of the rash, and continued until all the lesions become crusted. The incubation period is from 10 up to 21 days. وهي كلش مهمة لأن those women who are exposed and susceptible، من نقول susceptible يعني شنو؟ they have no previous infection with this virus. That is to say, they have no serological evidence of immunity against the disease. Those women who are exposed to any infected child or infected person should be followed up to 24 or 21 days, looking for any possible infection. And from this figure, you can see that the virus, the rash of the virus is characteristic. تشوفون إنه الvesicles is pathognomonic of this disease. Therefore, usually the diagnosis is made clinically. And although the virus can be isolated by scrubbing the vesicle base and performing tissue culture or via direct fluorescent antibody testing, but حقيقة there is no need, because from the clinical picture, the diagnosis will be readily made. And of course, PCR or the nucleic acid amplification techniques remained the gold standard diagnostic test for any infectious agent, because it is very sensitive. What about the fetus and neonate? If the mother becomes infected with this infectious agent during her first half of a pregnancy, that is to say, during the first 20 weeks of gestation, the fetus may develop congenital varicella syndrome. وهذا اللي قصدته إنه the child may be born with a congenital form of the disease. The features of congenital varicella syndrome includes eye defects in the form of chorioretinitis, microphthalmia, or cataracts, hypoplasia of the limbs, and neurological abnormalities in the form of cerebral cortical atrophy, microcephaly, mental retardation, or dysfunction of the bowel and bladder sphincters. As well, there will be skin scarring and dermatological distribution. This form or congenital varicella syndrome will not be evident if the infection is acquired during the second half of gestation. And this figure presents shows the hypoplasia of the limbs and skin scarring of congenital varicella syndrome. What about the management? Those women who are susceptible and exposed to an infected person should be given varicella zoster immunoglobulin within 10 days of exposure. This will prevent or attenuate varicella infection. إذن راح يستفادون من passive immunization with specific antibodies. However, women who become infected should be isolated from other pregnant women لأن ما لها حل يعني مجرد إنه they should be isolated to prevent spreading of infection because it is highly contagious, and mostly they only require supportive care. For example, antipyretic for the fever, emollients for the rash, antibiotics to prevent secondary bacterial infection, etc., whatever. But because it is a double-stranded DNA herpes virus, they might benefit from intravenous acyclovir therapy if they are presented within 24 hours of the onset of the rash. And this should be given at a dose of 10 up to 15 milligram per kg 3 times daily. Now, the second commonest example of viral infections is infection with robiola. This causes what is known as measles. Measles means الحصبة. This is again a highly contagious disease. It is caused by robiola, which is a single-stranded RNA virus that belongs to the Paramyxoviridae family. It causes non-specific symptoms in the infected adult or infected person in the form of fever, coryza, conjunctivitis, cough. But there is a characteristic sign which is the cope-like spots. طبعا أكيد كلكم سامعين بيها. These are clusters of white lesions that appears in the buccal mucosa opposite the lower first and second molars, usually manifested 2 to 3 days before the measles rash appearance. The measles rash is a maculopapular rash. It starts on the face and then spreads to the rest of the body, neck, back, trunk, and extremities. Here, the treatment for the mother will be only supportive, and again, passive immunization can be given to the mother in the form of immune serum globulin if they are presented within 6 days of exposure. But active immunization or active vaccination is never allowed during a pregnancy. Why? Because it is, as you know, it is a low attenuated virus. But susceptible women should be offered vaccination routinely after delivery. And this figure shows the measles rash. As you see, it is a bright red rash, maculopapular in its shape. And the cope-like spots, which are the white lesions that develop in the buccal mucosa against the first and second molars. ما أدري تسمعوني وياي؟ وياي عيني؟
دكتورة.
اوكي السلايدات وصوتي واضحين ان شاء الله؟
واضحين دكتور.
Okay. What about the fetal and neonatal effect? هنا you have to know that measles virus, that the robiola virus which causes measles, is not a teratogenic virus. يعني شنو؟ يعني it will not bring about and it will not cause any type or kind of anomalies. However, If the infection is transmitted to the fetus, there will be an increased frequency of spontaneous abortion, of preterm delivery, and of low birth weight neonates, that is to say IUGR, intrauterine growth restriction. So it is one of the causes of IUGR fetuses. But here it is of worth note or of important. It is important to know that if the infection is acquired shortly before birth, especially if delivery was a premature one, there will be a considerable risk for serious infection developing in the neonate. فهنا راح يكون the significance of measles infection. The third important example of viral infections that may be acquired during the pregnancy or that any pregnant woman be affected with is infection with rubella. Rubella is the causative agent of German measles. German measles من اسمها هي الحصبة الألمانية. What is rubella? It is an RNA togavirus. هنا الملاحظة اللطيفة أنه it typically causes infections of minor importance in the absence of a pregnancy. يعني infection in adults will be mild. However, if this infection is acquired during the first trimester, this will be directly responsible for spontaneous abortion and severe congenital malformations. وحقيقة rubella, it is one of the most teratogenic agents affecting the fetus. How it is transmitted? Transmission occurs via nasopharyngeal secretions. What about the mother? Clinically, they will develop, or the infected person will develop mild febrile illness, generalized maculopapular rash beginning on the face, spreading to the trunk and extremities. يعني طبعا الكرايتيريا مات of this rash is similar to that of measles rash, maculopapular, والdistribution هو the same. لكن هسه تشوفون من الفيجر اللي يلي انه it is less intensely red. As well, she might have arthralgias, develop arthralgias, arthritis, head and neck lymph adenopathy, and conjunctivitis. The incubation period from 14 up to 21 days. هنا أكو ملاحظة مهمة إنه despite half of maternal infections are subclinical, the presence of viremia in the blood may cause fetal infection with malformations. زين. هذا الفيجر شوفوا انه الكاركترستيك اوف the rash of rubella مثل ما تشوفوا يشبه الراش of measles, maculopapular and distributed all of the body, لكن يكون less intensely red. لو نرجع السلايد على الميزل راش شوفوا شلون يكون الكلر مالته. زين. What about congenital rubella syndrome? Congenital rubella syndrome.
دكتورة؟
نعم.
دكتورة شنو اكو علامات مميزة بالروبلا كلينيكالي حتى اقدر يعني اميزها عن الميزلز عامة؟
احنا مو ميزل بها الكوبليك سبوتس، هاي تكون باثوجنومونيك اوف ميزل راش، يعني عادة preceded by the coplic spots مثل ما قلنا ورا يوما إلى 3، بينما الكوبليك سبوتس ما موجودة بالروبلا. اوكي؟ بس كراش هو تقريبا نفس الشيء ما عدا الكلر مالته. في حالة الميزلز يكون more intensely red. زين. What about congenital rubella syndrome? Congenital rubella syndrome especially happened during the period, if the infection is acquired during the period of organogenesis. That is to say, during the first half of gestation. Features of congenital rubella syndrome includes eye defects in the form of cataracts, congenital glaucoma, pigmentary retinopathy, microphthalmia, heart disease in the form of patent ductus arteriosus, pulmonary artery stenosis, sensory neural deafness. Sensory neural deafness, خلوا ببالكم, it is the most common single defect if the infection is acquired after 16th week's gestation. يعني إذا المother صار infected with rubella virus after 16th week gestation, the only defect will be, the only single defect may be the sensory neural deafness. لذلك هذول اللي يطلعون ما يسمعون لازم نفكر ونخلي ببالنا، خاصة اللي ما عندهم family history، إنه واحدة من الأسباب هي maternal infection with rubella and of course with vertical transmission of the virus to the infected neonate. شو وقت يصير if this infection is acquired after 16 weeks gestation. Okay, other features of congenital rubella syndrome include central nervous system defects in the form of microcephaly, developmental delay, mental retardation, meningoencephalitis. As well, the infant will be grossly restricted. There will be neonatal purpura, hepatosplenomegaly, jaundice, as well radiolucent bone disease. And this figure shows some of the features of congenital rubella syndrome مثل ما تشوفون الكاتاراكت كذلك مثل ما قلنا الاي ديفكتس الأخرى هي تشمل الجلوكوما pigmentary retinopathy. بالنسبة للكاردياك عندنا البيتنت ductus arteriosus كذلك ممكن يصير عندها الانفات will be affected with pulmonary artery stenosis. هنا البرين كلش evident انه يكون microcephalic. What about the diagnosis? Rubella, although the virus may be isolated from urine, from nasopharynx of the mother طبعا infected mother, from the cerebrospinal fluid طبعا via performing PCR the polymerase chain reaction. But the diagnosis is usually made with rubella by serological analysis, يعني by detecting specific antibodies to the virus, IgG and IgM antibodies. What about the management and the prevention? For the treatment, there is no specific treatment for rubella, but the primary prevention relies on a comprehensive vaccination programs. الفاكسينيشن of rubella مثل ما تعرفون هو جزء من MMR يعني program اللي given during childhood. M here for measles, M الثانية for mumps stands for mumps, والR here rubella. لذلك those women who are susceptible يعني شنو they did not have a previous infection with rubella nor did they receive vaccination should be offered vaccination postpartum, post-delivery, postnatally. Now, another important example of viral infection is infection with parvovirus B19. حقيقة أنتم تتصورون هذا الفيروس غريب وما سامعين به لكن it is very important. ليش؟ هسه تعرفون ليش. أولاً, it causes erythema infectiosum or what is known as fifth disease. What is this virus? It is a single-stranded DNA herpes virus. It does replicates in rapidly proliferating cells. زين شنو مثل ايش rapidly proliferating cells هي erythroblast precursors. Erythroblast precursors if these precursors become destroyed, this will cause severe anemia in the affected infant and hence the development of hydrops fetalis. لذلك الفيتال افكت هو راح يكون من خلال هاي الكاركترستيك انه it replicates in rapidly proliferating cells واللي يهمنا هو erythroblast precursors. زين what about the mode of transmission? It does occur via respiratory droplets or hand-to-mouth contact. Clinically, infected woman will be or the infection will be asymptomatic in up to 50% of adults. Or those who are symptomatic will develop mild flu-like symptoms in the form of fever, headache, but several days later they will develop bright red rash with erythroderma, affecting the face, giving a slapped cheek appearance. Slapped cheek appearance هاي يسموها أو المعروف يعني الترجمة مالتها هي الخدود الملطومة يعني لطم الخدود. كذلك it will cause symmetrical polyarthralgia and arthritis that may persist several weeks. زين هذا الفيجر يعني ولا هو شوية صورة faint لكن يبين بشكل واضح السلابد تشيك appearance تشوفون خدوده شلون حمراء بالإضافة إلى الراش. Okay. What about fetal infection? شافوا إنه من خلال الدراسات شافوا إنه in about 1/3 of infected mothers a transmission, vertical transmission will happen or will occur. And the risk of intrauterine infection rise with increasing gestational age, being 15% less than 16 weeks of gestation, up to 25 up to 70% after 16 weeks gestation. فإذا the risk of vertical transmission will increase with increasing gestational age. What about fetal infection? Fetal infection will lead to either spontaneous miscarriage or non-immune hydrops fetalis or stillbirth. هنا أنا أرجع يعني أوضح لكم إنه ليش أنا ذكرت هذا الفيروس. لأن شافوا إنه it is the most common infectious cause of non-immune hydrops fetalis. hydrops fetalis مثل ما تشوفون هاي البيكتشر هي عبارة عن شنو؟ عبارة عن tissue edema and accumulation of fluids in all body cavities. مثل ما تشوفون هذا الفيجر شلون عندنا اكو large bilateral pleural effusions، اكو subcutaneous edema، اكو ascites. هنا طبعا الاميون الهايدروبس فيتالس اعتقد هو well known to most of you. It is broadly categorized into either immune hydrops fetalis مثل ما تعرفون الاميون hydrops هو caused by Rh isoimmunization، وال non-immune hydrops caused by others other etiologies. واحدة من عندها هي ال congenital infections. The other causes of non-immune hydrops مثلا severe fetal anemia due to genetic or other causes, severe lung deformities, severe heart or cardiac deformities, as well twin-to-twin transfusion syndrome. بالنسبة للcongenital or infectious causes of non-immune hydrops fetalis هم يتضمن a number of pathogens, a number of viruses or other pathogens. مثل ايش؟ مثل الparvoviral virus وهذا the most important. Other infectious agents that leads to the development of non-immune hydrops, cytomegalovirus, بعد protozoal and toxoplasmosis. Toxoplasmosis as an example of protozoal infection, and even syphilitic infection may cause hydrops fetalis. لكن شافوا انه infection with parvovirus B19 is the most important.
دكتورة
نعم.
الفيتال يصير
نعم.
دكتورة الفيتال يصير عنده أنيميا دكتورة من يجي؟
اي اذا هي الار بي سيز مالته كلها ديستراكتد اكيد لا شلون؟ يعني هو الايراثروبلاست
يعني دكتورة
البارفو راح تتحطم كلها. فمين يعني
دكتورة
نعم.
يعني both the mother and the fetus will develop anemia؟
لا احنا بدنا نحكي على الفيتس. علامات الام انا ذكرتها اذا تتذكر هذا السلايد clinically high manifestation اللي هي 50% asymptomatic، هاي بالنسبة للأم، وراح يصير عندها flu-like illness or symptoms يعني fever or headache، وبعدين several days later راح يصير عندها slapped cheek appearance rash، بالإضافة إلى البولي أرثرالجيا وأرثرايتس اللي تبقى أسابيع.
يعني دكتورة
هذه هي علامات
يعني
الأم.
بالأدلت ما تسوي؟
الهاي
يعني
دروب
دكتورة بالأدلت ما تسوي الأنيميا بس بالchildren بالأطفال يعني؟
طبعا أكيد طبعا. بس احنا بدنا نحكي على الفيتال افكشن حاليا اللي هو الهايدروبس فيتالس. زين هسه نجي على الدايجنوزز. Diagnosis of maternal infection is usually made by serological testing for specific IgM and IgG antibodies. لكن الفيتال infection احنا قلنا هي 1/3 of infected mothers will transmit the virus to their babies. How we can diagnose the presence of fetal infection? The diagnosis here is usually made by either performing the PCR or the amniotic fluid that is obtained via amniocentesis, or for the fetal blood that is obtained via chordocentesis, or by detecting parvoviral specific antibodies اللي هو IgM طبعا that indicates acute infection within the fetal blood. Okay? What about the management? المانجمنت هنا احنا نخاف من شنو؟ من الانيميا، مو صح؟ الانيميا اللي تسبق development of hydrops fetalis. لذلك طبعا اللايف تعرفون انه اي فيرال illness مثلا الانفلونزا الطبيعيه هي 3 ايام وخلاص هاي اللايف سايكل مالتها تنتهي. كذلك البارفوفيرال انفكشن شافوا انه يعني تقريبا 12 اسبوع وراها هي يعني everything will subside. لذلك serial sonography should be offered every 2 weeks for any woman proved to be infected with parvoviral infection. up to 12 weeks after infection. زين هنا حتى ندور بهذا الالتراساوند we have to look for evidence any evidence for the development of anemia, fetal anemia. شلون؟ من خلال انه looking for example for the blood flow through the middle cerebral artery by of course Doppler evaluation, Doppler ultrasonographic evaluation. لأن مثل ما تعرفون في حالة الفيتال أنيميا راح تزيد سرعة الدم بالميدل cerebral artery كبارت من يعني كجزء من البروتكتيف ميكانيزم حتى يسموها brain sparing effect. فإذا من نشوف the blood flow begins to increase through the middle cerebral artery, this may predict the development of fetal anemia. As well, fetal blood sampling is warranted with high drops to assess the degree of fetal anemia. يعني احنا سوينا الكوردوسينثيسيس شيكنا ال HB for the fetus إذا لقيناه on the low side and the fetus near a viable gestation. يعني شو نقصد؟ نقصد مثلا انه for example عمره 32 اسبوع فهو لقينا عنده انيميا ممكن شو ننطي؟ ممكن ننطيه intrafetal blood transfusion حتى this may improve outcome in some cases يعني to save his life. يعني مثل ما تعرفون إذا جاوزنا مشكلة الأنيميا ممكن يعني ورا ما ينتهي ال illness اللي هي up to 12 week gestation the fetus may survive. هسه نجي على fifth common example of viral infections هو السيتوميجالوفيروس. الCMV مثل ما تعرفون هو اسمه بالعربي هو الفيروس المضخم للخلايا. What is this virus? It is a double-stranded DNA herpes virus. زين. الترانسميشن شلون راح يكون؟ هذا المشكلة مالته إنه it is present in all body fluids. يعني شنو؟ يعني once the infection occurs, it may be detected in the blood, in the urine, CSF, serum, saliva, nasopharyngeal secretions, semen, cervical secretions, etc. Therefore, the transmission occurs via contamination with these infected body fluids. As well, there will be transmission of the virus to the baby, that is to say, it is vertically transmitted through the placenta, or it can be transmitted during the process of birth because of the contamination with infected cervical and vaginal secretions, as well as postnatally or during breastfeeding. هنا شنو؟ most infections are asymptomatic. يعني هواية من عندنا هسه من نسوي نفسنا screening for specific IgM and IgG antibodies to the cytomegalovirus نشوفه انه موجود يعني positive لكن احنا ما حسينا يعني سابقا مثلا او ما نعرف انه سابقا صاير عندنا هذا الفيروس. Some will experience a mononucleosis-like syndrome in the form of fever, headache, pharyngitis, lymphadenopathy, myalgia, polyarthritis. يعني تشوفون تقريبا هاي العلامات هي common to most of viral illnesses. Less commonly, pneumonia and hepatitis may be a feature as well. هنا عندنا شغلة أو عندنا good important ملاحظة مهمة اللي هي شنو؟ If the mother becomes infected for the first time يعني ما عندها previous CMV infection, the risk of vertical transmission will be up to 40%. يعني شوفوا النسبة قد عالية. And this can cause severe morbidity. While if the mother is reinfected with this virus, the risk of vertical transmission will be much lower and not exceeding 1%. لذلك الخطورة بالvertical transmission راح تكمن في زيادة في حالة being infected for the first time. زين. Of course, the risk of transmission is increased with increasing gestational age. هاي معروفة. لكن as any infection during a pregnancy, fetal damage will be more serious the earlier in gestation the transmission occurs. What about congenital infection? The congenital form of the disease will be in the form of a syndrome that includes the following features: growth restriction, microcephaly, intracranial calcifications. انتبهوا على هذه النقطة الانتراكرانيال calcifications لأنها راح تفيدنا بالantenatal diagnosis of fetal infection. As well, the other features will include chorioretinitis, might include chorioretinitis, mental and motor retardation, sensory and neural deficits, hepatosplenomegaly, jaundice, hemolytic anemia, and thrombocytopenic purpura. Some may develop late onset sequelae. يعني هو يطلع للدنيا ما عنده مشكلة لكن بعدين يشوفون عنده فد hearing loss يشوفون عنده neurological deficits, chorioretinitis, psychomotor retardation and learning disabilities يعني حتى يحتاج صفوف خاصة بالمدارس. هذا الفيجر it very obviously shows the presence of intracranial calcifications. زين. بالنسبة للdiagnosis حقيقة serological testing is not routinely or usually recommended. يعني by screening the woman for antibodies against the virus is not recommended usually. Viral culture may be useful, but a minimum of 21 days may be required before the culture can be reported as negative. زين. لعد شنو المهم طبعا احنا ليش نقول هذا ما مهم انه نشخص الام صاير بيها؟ لأنه أولاً هو موجود وعادة يعني asymptomatic والrisk of transmission يعني إذا هي عندها recurrent infection أقل ما يتجاوز 1%. لذلك إحنا اللي يهمنا إنه هل فعلاً البيبي infected with CMV virus لو لا. لذلك the imaging studies that might detect the presence of fetal infection includes sonography, CT scan and magnetic resonance imaging. ايش راح نشوف بيها؟ راح نشوف الفيتشرز اللي مثل ما قلنا مثلا الانتراكرانيال calcifications، نشوف المايكروسيفالي، نشوف الهيباتوسبلينوميجالي whatever. What about the definitive diagnostic test? يعني as I said that the nucleic acid amplification testing remains the gold standard diagnostic test for any infectious agent. زين. What about the management and the prevention? Treatment for the mother is symptomatic. However, passive immunization with CMV-specific hyperimmunoglobulin, if it is given to the mother, this will significantly lower the risk of vertical transmission of the virus to her baby. هذا شو وقت ننطي للmother who are infected for the first time يعني risk of transmission 40%. أما those with recurrent infection ماكو داعي. زين. If there is any specific CMV vaccine لحد الآن إحنا ما سامعين ماكو يعني أكو vaccine for the cytomegalovirus. لكن بما أنه قلنا the transmission of this virus إلى علاقة بالcontamination with all body fluids من ضمنها nasopharyngeal secretions, semen, saliva, urine. لذلك basic measures should rely on a good hygiene and hand washing to prevent transmission of infection. عندكم سؤال قبل لا نجي للسؤال اللي نطرحه بالمحاضرة على مود تجاوبون عليه بالشات؟ أكو شيء مو واضح عندكم؟
دكتورة العفو
نعم.
محاضرة بس
نعم.
أكو طلاب جاي يحاكوني يقولون إنه الميتنج يعني العدد مالته مقبض فما نقدر ندخل
مو أنا لينكين حاطة واثنيناتهم مفتوحات.
ما أدري هم شو داخلين كلهم بلينك واحد.
ليش لينكين أنا حاطة بالمحاضرة؟ شلون يصير؟ وكل لينك يتحمل يعني يتحمل 100 تعرفون.
اي صحيح دكتور بس هم جزء عبالهم لينك واحد داخلين كلهم.
لا حتى شوفوا اكو هسه 100 لا اكو لينكين موجودات عندكم بالستريم.
تمام دكتورة.
خلي يدخلون الباقين بعد هو المفروض أنا انطيت المحاضرة. زين.
اي نعم دكتور هذا هو ان شاء الله.
هسه دخلوا الباقين؟
المفروض موجودين باللينك الثاني.
المفروض بعد ما اعرف اني خلينا نشوف اللينك الثاني. اللينك الثاني بيه 9.
اي دكتور هذا اللينك بيه 100.
101 اي تقريبا 100 وياي 101 اي. يعني البقية المفروض أكثر من 9 يدخلون. على كل يعني بعد هو واضح
تمام
عليه.
دكتور إن شاء الله.
زين هسه السؤال، هسه السلايد شو راح أسده.